We the peoples are gradually developing and developing. Our country is a developing country. We are trying to follow the developed country. And every steps of our activity is going towards that developed one. And with the people are doctor, especially the surgeons, we are working along with the anesthesiologist. So our team member is surgeon, anesthesiologist, and others co-assistants. So our plan is improving gradually from the previous day. Once upon a time, anesthesia was given by a surgeon and do the surgery by the same one. Similarly, whenever first gynecology started gynecological surgery, the surgeon used to give the spinal anesthesia and do the surgery by herself. But days coming, the changing continuously being known. So gradually the development is going on. So we definitely follow the Western policy. What is the actually Western policy? And pre-anesthetic checkup is one of the important policy in the Western world, and we are not outside the Western planning. So what happens? First of all, we have to be counseling the patient regarding few important topics for having a uneventful anesthesia and uneventful surgery. So first of all, we need to optimize the patients before going to operation, especially the elective cases. This optimization includes three important things. One is hydration. If the patient suffering from dehydration by some disease process like pyloric stenosis or even some condition, the choledocholithiasis, hydration is a must. Then important is the glycemic control. If the patient suffering from long-standing diabetes, diabetes control is a prerequisite before starting your operation and to have a very good outcome. Serum albumin level is a must to see that of the liver function level. Similarly, serum creatinine is also another indicator for renal function status. We need to check the coagulation status. Especially the prothrombin time is one of the important factor which is very much essential in operation in choledocholithiasis. Prothrombin time should be corrected either by giving vitamin K IV or if necessary blood transfusion. Sometimes blood transfusion, better planning is also that without blood transfusion, that is fresh frozen plasma. Now the blood pressure and other comorbid condition like that of the heart disease and respiratory problems. You see, our people has got a conception that whenever the patient suffering from hypertension, just after giving 1 to 2 doses of antihypertensive drugs, the patient is all right and the surgery could be performed. This is absolutely a wrong planning. You have to control the blood pressure by giving antihypertensive and check it weekly, and at least for 15 days is required to have a control stable blood pressure. Similarly, cardiac problem like myocardial infarction or respiratory reserve should be definitely one of the important factor if necessary by using a spirometer. So these are all the thing you have to be maintained. More important is that of the post-operative management, especially the pain, the first 4 hours according to the WHO recommended safety checklist should be checked, should be done by an anesthesiologist. Whenever the management, the patient should also inform the whenever the patient is whatever the patient is either required after operation in ICU or ward. If the patient is required ICU, how many days he could have required there, the financial solvency, whether permit or not. When you return back to ward, how will you return back to the daily life? These are all information you have to given to the patient. And lastly, whether the patient needs to be further management follow-up, this is also a part of surgeon, but the anesthesiology should have introduced it to the patient while he's check up the patient in pre-anesthetic checkup time. This is, I think, more or less regarding that of the pre-anesthetic checkup and its activity towards a patient for having a good, successful, healthy discharge and a safety life, and in future a good benefit from our surgical team. Thank you.